Why is it so important for patients to know that having several conditions linked to type 2 inflammation can mean a more severe disease state? We answer this question and unpack why quickly treating inflammation, not just the symptoms, can help manage these conditions better. This podcast is made in partnership with the Allergy and Asthma Network, and we want to thank Sanofi for sponsoring today's episode. While they support the show, all opinions are our own, and sponsorship doesn't influence our content or editorial decisions. Any mentions of brands is for informational purposes only and not an endorsement. Now let's get into it.
You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
Today we have a super special guest, one of my favorites, Dr. Michael Blaiss. He is a mentor and a friend, and we've known each other now almost for 10 years, which is hard to believe. Today he's going to take us through the connection between comorbid conditions and type 2 inflammation. So Michael, will you introduce yourself for everyone, please?
Yeah, well, thanks for having me. This is a real pleasure to be part of this. And congratulations I think you're up to your 100th podcast now. So that's absolutely terrific. And the service you do out there for educating, because we need great education out there for people to understand about their allergies. So I am Dr. Michael Blaiss. I'm a clinical professor of pediatrics at the Medical College of Georgia at Augusta University in Augusta, Georgia. Also see patients at Good Samaritan Gwinnett. This is a basically free clinic for patients that are not insured in an underserved area of Atlanta. And I'm a past president of the American College of Allergy, Asthma, and Immunology. So again, it's a pleasure to be here with you.
Michael's had like 20 lives. He has done probably every single type of allergy job you could imagine. And now he is doing the best type, which is giving time for service to people who really need medical care. So thank you for doing that. I really respect that. And I hope that I put a little bit more of that into my life very soon. So looking at what we want to get into, we did talk about type 2 inflammation and what it is in our last episode. So if you haven't checked that out, you should. So today we're really going to focus on the comorbid conditions. So what diseases are commonly associated with type 2 inflammation?
Well, there are numerous diseases, and we continue to learn more and more that have elements of type 2 inflammation. So we can really start with the upper airway. Allergic rhinitis, in fact, is a type 2 inflammatory condition. Also, another major problem is chronic rhinosinusitis with nasal polyps. So those are major problems. If we go down to the lower airway, asthma, which obviously is a major problem in the patient population. There are elements of COPD, or there are groups of patients with COPD that may have increased levels of eosinophils, which seems to be also a type 2 inflammatory condition. And something that we may see with the asthma and with the nasal polyps is NSAID or aspirin exacerbatory respiratory disease. So those all go hand in hand. The skin is extremely important, probably number one there being atopic dermatitis or eczema, but we also are finding elements of type 2 inflammation associated with chronic spontaneous urticaria and also Prurigo nodularis, which is an extremely itchy raised type of rash also. So in fact, all of these skin conditions with type 2 inflammation have itch as a major symptom. We can also talk about the GI system. And one of the major ones there is eosinophilic esophagitis, again, affecting the food tube, the esophagus, which can lead to strictures and food impaction for patients that have severe disease. And we can also include in there food allergy. So really, all of these types of things are extremely common in the population. Unfortunately, for so many of our patients, they have more than one of these at a time, which really just compounds the issue for them.
So I'm one of those patients who has a bunch of those things, and I'm just curious, how often do patients experience multiple conditions with type 2 inflammation?
It's extremely common. And again, there are a lot of studies that have looked at this, but I've seen studies where up to 40% of patients with atopic dermatitis also have allergic rhinitis. You see the same types of numbers when you look at asthma and allergic rhinitis, or asthma along with nasal polyps. I've seen some numbers in like the 10 to 15% range. So again, it's extremely common. And one of the things when I'm lecturing, and in fact, last weekend I was lecturing to a group of ENT fellows from around the country on chronic rhinosinusitis with nasal polyps, and stressing how this is a type 2 inflammatory condition for the vast majority of patients we see in the United States. I said one of the things they have to always look for are those comorbidities, because such a high percent of those patients also have asthma. I think patients also need to understand that if they have one of these type 2 conditions, they need to be concerned about the possibility of either having one already, another comorbidity, or developing one over time.
And then how does the presence of comorbid conditions influence the management and treatment of these patients with these type 2 inflammatory diseases?
I think that's key. And this was one of the reasons I was discussing this with the ENT fellows, is that you have a patient with asthma and chronic rhinosinusitis with nasal polyps. If you look at the data, that patient's asthma that has the nasal polyps is much more severe than the group that has just asthma alone. So there seems to be this compounding factor here that if you have more than one type 2 inflammatory conditions, those conditions tend to be much more severe than if you just have one isolated condition. And I think that's extremely important because it determines for me how aggressive I want to be in the management of that patient. So I may not treat as aggressively that patient with asthma alone versus that patient that comes to see me that has asthma and nasal polyps. So I think it's a real key here as far as learning about the severity of their condition, and again, how aggressive we need to be in the management of their condition.
And one of the things that we hear often is that type 2 inflammation actually occurs more often in those patients with moderate to severe disease in general. Is that accurate?
Yes, so we do see that, at least in the US and the population that we're dealing with. It doesn't mean that patients that have non-type 2 asthma cannot have a very severe disease. And in fact, some of my most severe patients have been non-type 2 and have been steroid dependent. But nevertheless, I do see these that especially have a lot of comorbidities. They tend to be the worst of the worst. In fact, the worst patients I have are patients with asthma, nasal polyps, and aspirin exacerbatory respiratory disease. So they have sensitivity to aspirin, things like naproxen, ibuprofen, Aleve, Advil, those types of things. They're the ones that I see. They're the frequent flyers. They're always in the emergency department, hospitalized, and patients I've had with asthma in ICU almost always fit that category. So there's no doubt that these are some of the worst patients.
And we're not going into specific medications, but essentially the medications that do treat type 2 inflammation, they can help multiple conditions simultaneously.
Yeah, I think it's exciting that we have certain products available now, certain biologics that in fact do have indications in the United States for more than one type 2 inflammatory condition. I think it's great for the patient in the sense that you're not having to take multiple different drugs, because I have to take my asthma drugs and I've got to take my atopic dermatitis ointments and stuff. So to have something that takes care of the problem all over, because it is a systemic condition, I think is great for the patient population.
So if I understand that correctly, if you do have multiple conditions that fall under the umbrella type 2 inflammation, as a doctor, are you looking at treating all of the conditions together, or do you kind of pinpoint one and then hope that it has a knock-on effect and impacts the other ones positively?
I kind of try to take a look at the whole thing. So in other words, all the conditions that the patient has, and discuss with them, work with them to, again, determine what in fact may be the best treatment for their condition. This gets back to the importance of shared decision making. So I can bring up the different treatments that are available and how this treatment would take care of this, and this treatment would only take care of this. and then working with them, letting them determine as far as their values and preferences, which direction, in fact, they may want to go. An example would be someone that has nasal polyps. Let's say they have just mild asthma at this time. Well, we could treat it medically. If the polyps are the worst problem, they may want to try to do surgery first. Again, I think you have to have a discussion with the patient so they know the benefits and risk and possible outcomes of each treatment and determine then which way would be the best to go. There's no doubt, I think most patients, I know I would, if I could just take one treatment instead of several treatments, that's what I'm going to do. But everybody's different. And so I think that's why you have to work with the patient to come up with the best options.
I can talk a little bit about this as a patient perspective. I asked the question selfishly. But, I think what you were saying is really valid because I had moderate to severe asthma. So I was taking asthma medication every day. I also had severe atopic dermatitis. And it got to a point where, any topicals stopped working for me. Together with my doctor, I had all of these different medicines that I was taking. And I was also felt like I had no control over anything. So I spoke with my doctor and he was able to really look at me as a whole person instead of just my skin or just my lungs. And we were able to decide together that I should go on a biologic. And I have to say that having Dr. G on my side has been super helpful because she's been able to talk me through all of this as well. So I can say that as a patient, that was a really important kind of holistic overview of being treated. But as a patient who maybe has multiple conditions that are type 2 inflammation, how do they start that conversation? How do they decide maybe this is all connected and maybe I should talk to my doctor about it all being connected? Because sometimes, so I'm in Germany, so it's also a little bit different that the doctors don't talk to each other. And so you get your diagnosis from your pulmonologist, then you get your diagnosis from your dermatologist, and you don't necessarily as a patient put two and two together. So that's a very long way to ask you, how do patients put two and two together? And then how do they decide what to do moving forward?
That's a difficult situation in the United States too, because in fact, the ENTs are going to worry about the nose, the allergic rhinitis, the polyps, but they're not going to really be that concerned about asthma or atopic dermatitis. And if we take the dermatologist, they're important as far as the eczema, but they're not concerned about your asthma condition. I think one is to have a good primary care doctor that you can work with that can put this together. I think the other thing is, and I guess I'm biased here as an allergist, one of the things you always hear about allergists is that, we don't have an organ system. So the dermatologists have the skin and the ENTs have the nose and the GI docs have obviously the GI tract. But if you think about it, we're the type 2 immunology physicians because basically we take care of all of these conditions. So I think if you have patients out there, which I'm sure you do that are listening, that have more than one of these type 2 conditions that we mentioned, then getting with a board certified allergist who has been taking care of all these things may be the most appropriate doctor for them to, again, work holistically here to take care of the whole person or the whole type 2 inflammatory problems and not just the isolated skin or the isolated nose or the isolated lungs. But that is a major problem out there. We're so specialized now and everyone has their little niche. But I guess the good news here is that the allergist takes care of all of these conditions.
Yeah, I find that a lot with patients where they have the pulmonologist, then they have the dermatologist, then they come to see me and it gets confusing for them on who am I listening to? And it's almost like too many cooks in the kitchen, right? I never want to take a patient away from a physician, but I do let them know that we treat all of these conditions so we can streamline all of this and we can try to manage all of this together and not have the patient have to be seen by multiple physicians constantly. And if there is a reason that we're concerned about their lungs or about their skin and we need extra input, then maybe they can go back to that dermatologist or that pulmonologist or the ENT or the GI doctor. But at the end of the day, we're almost like that primary care doctor that's managing the whole situation and then referring out when we need extra support. I think that that's something that patients sometimes need to hear and understand a little bit. So thank you for talking about that.
Yeah, I think it's important. And I think one is, and the education here is so important, is that a lot of patients don't realize, in fact, there is a connection between all of these conditions. I mean, who would think, something that's causing problems swallowing food be related to, in fact, having a skin condition? So the more education people can get about the conditions they have, and again, work with their clinician, the better care hopefully they'll get.
And really, the reason that, Michael, you went to talk to those ENTs was because you're trying to bring that education over there too, right? So we need to have more cross pollination. We need to be talking to the dermatologists, to the GI doctors, to the pulmonologists to let them know that this link exists, so that if that patient is in their office and they hear that they have these other comorbid conditions, that they understand that there is a link, and that we do need to think about that as we're figuring out what we're going to do for their treatment plan.
Yeah, that was really the whole point to one of the talks that I gave them, is that they have to realize that there are these other conditions going on that are making, in fact, the patient's nasal polyp condition in most cases worse. And as they mentioned, they had so many patients that surgery failed, and they've had multiple surgeries for their nasal polyps. And these typically are the patients that have type 2 disease, because as we talked about, you're really not turning off the underlying inflammation that's occurring in the patient. So again, education for all of us so that we can better manage patients.
I'm curious, is there something that can tell a patient that these different diseases are talking to each other? Is there some sort of overlap that says, oh, you know what, maybe what's going on with your nose and what's going on with your GI tract, they're related? Is there something that tells us that it's type 2 inflammation?
I'm not sure there's anything other than having the conditions themselves. And again, most of us wouldn't think of trouble with swallowing would be related to a skin condition. I think that is extremely difficult for the patient. There's not one particular test or one symptom that says, oh, I'm going to have all of these conditions. I think that leads to the difficulty there, and why patients end up with so many different doctors to take care of these conditions, because there's just not, in most cases, a major clue there. So it's not like a hereditary type of condition in the sense that, mom and dad had asthma, so that makes me more likely to have eosinophilic esophagitis. Makes me more likely just to have asthma. So you get into those types of situations. So I think it's going to kind of take research from the patient and getting to the right doctors to get the proper care.
So in the last episode, I'd mentioned markers for type 2 inflammation, and two of those markers are blood eosinophils and IgE levels. And of course, they're just markers, which means that we do have to be careful in the way that we utilize them. But what do you think about those markers?
So they can be. There's so many variables here, and IG levels fluctuate so much. They're different in the morning than they are in the afternoon. And IG levels are not necessarily correlate with disease, including allergic rhinitis. So I'm not a big fan of those saying for sure, or sending someone saying, go get a blood eosinophil count. And if it's high, that tells you have type 2 disease. It may, but it may not. In other words, it could still be low and you still could have type 2 disease because there's high variability. So I don't think there's a clear, easy blood test out there that you could tell patients to get that would tell them they're prone to type 2 disease. So that's kind of my thoughts about it. It may be a little different than other physicians. But there's just such high variability. As we know, certain medications you take affect blood eosinophil levels. If you have certain conditions, even obesity affects blood eosinophil levels. So it can vary. So I don't want someone to think if they had a low level would not necessarily have type 2 disease. That's my concern with that, at least for a lay individual to interpret.
Yes, it's definitely not black and white. And biomarkers are just suggestive of possible condition, and you have to use the history, the clinical picture, and the blood tests to kind of put everything together. And if some of that doesn't match up, it doesn't mean that you don't have type 2 inflammation, but we use all of that together to try to help us and help identify patients that may have type 2 inflammation, and that these medications would work for.
So basically, you guys are telling us that AI can't take over your jobs just yet when diagnosing type 2 inflammation?
I don't think they could take over the job as yet. I think all the information's important. And when you do, and I think AI does this, you put all of it together, which is what we do, then you come up with an answer. But I don't think there's just one measure there that absolutely says you have type 2 disease or you don't have type 2 disease. And we know for many patients, they may have elements of type 2 disease, but also elements of non-type 2 disease. So it's not like you're either type 2 or non-type 2, but there can be overlaps there also. And that may be some of the patients don't respond as well to some of the type 2 treatments compared to other patients. So we have to realize that these are not just discrete conditions, but there is a lot of overlap here with the immune system. And so just saying you have type 2 disease or non-type 2 disease, it doesn't mean there aren't patients that have an overlap.
Absolutely. And that's super important for patients to remember and for doctors to remember too.
If you're a patient who has one of these diseases that type 2 inflammation covers, but you don't necessarily have another one, are you in the clear, or is there something that they can do to potentially prevent other type 2 diseases from occurring in their body? You know, just someone who's listening to this saying, oh, I have one of these. Am I going to get another one?
So the answer to that is it's still possible. As far as prevention goes, I think there's a lot of work going on, and there are infant, young children studies going on that if you can turn off this atopic march, so say that child that starts with allergic rhinitis, and we know they're at a higher rate of going on to develop asthma. Can you do something early in life to prevent that from happening? We know that allergen immunotherapy is, in fact, disease modifying. And at least there is data to suggest that, again, that child with allergic rhinitis who's placed on immunotherapy decreases their risk as far as developing asthma. So I think there are things like that that may be of benefit. What we don't know is some of these newer treatments that we're using, like the biologics, or they have any type of disease modifying activity. So in fact, if you do start one of these early, say a very young child with atopic dermatitis, will you in fact prevent them from developing other type 2 conditions as they get older? So we just don't know the answer to that right now. Hopefully in several years we will. But the point is, I think for right now, is to aggressively treat the problem the patient has now, to control that underlying inflammation, and to, again, improve their medical care.
We're going to talk about treatment more in the next episode, but why, Michael, are you saying that it's so important to treat that underlying type 2 inflammation or inflammation in general for patients that have any of these conditions?
I think it is important. And the reason is because we know that over time with type 2 inflammation, you can get changes that occur that are in fact irreversible. Just to give an example, let's use asthma example, where one in fact can get significant airway inflammation, which can lead to fixed disease to occur in the patient. So in other words, you get changes in the lungs with decreased lung function that's due to, again, the airway remodeling that is occurring due to the inflammation. So if one can in fact turn off that inflammation and therefore decrease this probability of airway remodeling, one is not going to get that damage occur in the lungs. We have good data now that the more exacerbations patients have, flare-ups of their asthma, we know that over time they have a much rapid decrease in their lung function compared to patients with asthma that in fact do not have these frequent exacerbations. So controlling exacerbations, controlling that underlying inflammation is very important for lung health and to prevent deterioration of lung function over time.
So when you're talking about remodeling, because that's a term you just used, does that mean that you're basically changing the way that the lungs look? So I'm thinking about like remodeling a house. So I'm going to just tear everything out and have a new, wallpaper. Is that what's going on with the lungs?
So you are getting, I guess the best way to explain it is you're getting fibrosis, or you're getting changes that are occurring in the lung tissue, which in fact can lead to constriction or worsening of the airways, and that this fibrosis that occurs, it generally can't be reversed. So in other words, you're leading to a certain amount of damage that's occurring in the lung tissue that hopefully by treating the underlying type 2 inflammation vigorously, we can prevent from happening.
Thank you so much, Dr. Blaiss, for joining us. I feel like this can get really intimidating. I know that our first episode about type 2 inflammation was super interesting, but if you're not into science, and I'm thinking of my husband here, he would totally have been like overwhelmed. You really brought this home for us, and we can really understand kind of type 2 inflammation, and now patients can understand why it's important to know about type 2 inflammation and how they can talk to their doctors about maybe if they are concerned they have it. So thank you so much for joining us today.
Well, thanks for having me. It was a lot of fun today, and I enjoyed, and y'all do such a great job.
Thank you. I can't believe it took us this long to have you as a guest. 102 episodes is, I guess, where you meant to be.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.